What to do now that I'm not responding well to an SSRI? Are there things like neurostimulation or other procedures that can help? Neurostimulation techniques are widely used for depression. They're available. For anxiety, it's still emerging. There was some exciting movement. There was just an FDA approval of a home neurostimulation device. That's the Modius device. I haven't seen it really implemented or carried out quite yet. It is brand new. I carry some skepticism, wanting to wait and see exactly what comes from it. Considering how it's impacted other areas, I think it's an exciting area of growth. In addition to the FDA-approved device that we just mentioned, there's also an FDA-cleared device, the cranial electrical stimulation, which are somewhat similar to devices that people have heard about for chronic pain that's using electrical stimulation, but this for cranial stimulation. There's a bunch of different devices out there. Alpha Stim is the one that I specifically have heard the most about. It is something that's FDA cleared. You can work with a clinician and talk about if that's something right for you. It does take some time. These units can cost a pretty penny as well. In addition to those, we want to talk about some of the things that are a little bit more widely available and utilized more commonly when SSRIs are not working. First is, what is going wrong with the current medication? Is there a different type of medication that's going to be better? So some people have side effects to the SSRI. People can metabolize SSRIs differently. Switching to a different one may be better for that person. There's also the option of looking at a different mechanism of action. This is where we may use a medication that's more specifically targeting a specific receptor that's not the same as an SSRI. May add an SNRI, adds an extra mechanism of action to get different kind of effect. We may be able to adjust the medication to better suit what's going on for that person. Second thing is, we want to look at the therapy options for this person. What can we do from a therapy standpoint to help with this ongoing impending doom or sense of anxiety? There's a lot of evidence-based therapies. Exposure-based therapy, cognitive processing-based therapy, EMDR, can be a helpful way of working with trauma-based anxiety. There's other types of therapies that will work with people who have generalized anxiety disorder, CBT, acceptance and commitment-based therapies. They're all studied to be highly effective for people with ongoing anxiety, especially if they're not responding well to a first-line medication. The final piece that we want to talk about is lifestyle interventions. It's always important to look at how their sleep is, what their circadian rhythm looks like throughout the day, what their exercise and physical activity looks like. Consistent amounts of exercise can actually have drastic improvements of anxiety. There are a lot of options to help when an SSRI hasn't been the most effective treatment. I hope this helps you move forward with your anxiety, and look forward to any more questions.